Hi, my name is Rob Hermann and I'm the President of the Australasian College of Podiatric Surgeons. Professionally, the ACPS represents podiatric surgeons who are registered as specialists by the Podiatric Board of Australia, irrespective of which training pathway they have undertaken. ACPS membership includes podiatric surgeons who have trained in Australia or in other countries such as the USA and the UK. The College is the peak organisation for podiatric surgeons in Australia, and we are committed to promoting the highest standards of podiatric surgical practice and education. We also seek to advance the specialty of podiatric surgery through research and professional development. Podiatric surgeons have been practicing in Australia for 45 years, significantly longer than any other subspecialty in foot and ankle surgery. Now, I would like to take this opportunity to tell you about podiatric surgery, what we do, and how our specialty improves the lives of people with foot and ankle conditions, often using simple procedures. I would also like to address some issues raised by other health professions about how we practice our specialty, the success of our outcomes, and the current inequity from a funding perspective for our patients. But firstly, put simply, podiatric surgery is a branch of healthcare that specialises in the surgical treatment of foot and ankle conditions. Podiatric surgeons are qualified to diagnose foot and ankle conditions and, where indicated, perform surgery. Our practice can range from simple ingrown toenail removal to more complex procedures such as reconstructive foot and ankle surgery. Some common foot and ankle conditions that may require surgery include bunions, hamartoes, plantar fasciitis, ankle sprains, and fractures. Podiatric surgery may also be necessary for conditions such as nerve entrapment, arthritis, and other deformities of the foot and ankle. Foot and ankle problems are experienced across the population, affecting millions of Australians each year. And we've seen the demand for podiatric surgery increase by 42% in the last 10 years. This increase in demand for podiatric surgery is due in part to the ageing population and risk factors such as obesity and diabetes. Also, emergency department presentations related to dislocations, sprain and strain of joints and ligaments of the ankle and foot are up 4.4% since 2017. So there's a strong demand for our professional services. Podiatric surgery has existed in Australia for 45 years. Specialist registration for podiatric surgery was approved by the Australian Health Workforce Ministerial Council in 2010. Furthermore, the Fellowship Training Program of the Australasian College of Podiatric Surgeons has been re-accredited in 2023. The specialty recognition and training accreditation of podiatric surgery occurs under the jurisdiction of the Australian Health Practitioners Regulatory Authority, or AHPRA. AHPRA is the same regulatory authority that accredits the training and registers all medical and dental specialties. As a small specialty group, there is sometimes a lack of understanding from other health disciplines about, among other things, our training and how we manage complications following surgery. Firstly, podiatric surgeons in Australia undergo extensive training that has been independently accredited by the Podiatric Board of Australia and AHPRA. Training in podiatric surgery involves a minimum of 4 years undergraduate study, followed by 2 years pre-vocational experience and training, and then a further 6 years of experience and postgraduate study in podiatric medicine and surgery. Surgical training requires extensive supervised clinical practice. This means it takes 12 years to become a registered specialist podiatric surgeon in Australia. Under national law, podiatric surgeons are permitted, like all other surgeons and various healthcare practitioners, to use the title doctor and podiatric surgeon. The permission to use these titles underwent extensive stakeholder consultation and was approved by the Australian Health Workforce Ministerial Council in 2010. There are regulations in place that require podiatric surgeons use these titles in a specific manner, and the ACPS has a policy to assist members in complying with such requirements. I do acknowledge that some healthcare organisations are not comfortable with broadening scope of practice and recognition through titles. Such groups seek a return to old-fashioned silos and outdated hierarchical structures in healthcare. These groups may protest on the grounds of public interest. However, even a superficial analysis suggests such protests are more likely grounded in protection of professional turf and self-interest. Unlike some of our colleagues from other surgical disciplines, the therapeutic training for podiatric surgeons focuses on conservative treatment, that is to say, the avoidance of surgery. This means that podiatric surgeons will ensure all reasonable, non-surgical measures have been taken before proceeding to surgery. Whilst generally the work we do is highly successful, post-operative complications arising from podiatric surgery can and do occur. However, it is important to realise that every surgical procedure undertaken by any surgeon, not just podiatric surgeons, come with the risk of complications. Importantly, there is strong evidence that the risks associated with podiatric surgery are low. In fact, podiatric surgery has an excellent record of safety and quality. I can assure you that almost all procedures are successful in the immediate postoperative period, and that for midterm outcomes, patient satisfaction rates are highly favourable. Now let's examine some facts regarding the outcomes of podiatric surgery. Based on qualitative audit data collected between 2014 and 2017, research shows that podiatric surgery has a high level of patient satisfaction and quality of care outcomes. ACPS National Quantitative Audit Data reviewed 20,000 admissions from 2012 to 2022 and reports an extremely low hospital readmission rate of 0.3%. Of all podiatric surgery cases, 97% are performed as day surgery. In 2022, there were more than 3,000 Australians helped by podiatric surgery, and 97.4% had no complications of any type in the first 30 days. This data provides good evidence of safe and high-quality care provided by podiatric surgeons in Australia. Nevertheless, we are trained to identify and manage post-surgical complications, which in the vast majority of cases are appropriately resolved. Continuous quality improvement is one of the main pillars of college activity. Members of the ACPS must participate in national peer review and quality improvement of their surgical practice to maintain their college accreditation. This mandatory requirement for college accreditation requires all members to audit their surgical outcomes and participate in yearly peer review to improve quality of care. Uniquely, the ACPS has 100% compliance with clinical audit participation, a fact that is only matched by vascular and breast cancer surgeons. This quality improvement activity requires ACPS members capture data for every case of podiatric surgery they perform each year. Preoperative and postoperative data, including all complications in the first 30 days after surgery, are captured using an online audit tool. The online audit tool has been developed using consensus of a panel of international experts in foot and ankle surgery. The attributes of the ACPS online audit tool means that it's the only quality improvement instrument of its type in Australia. All ACPS audit data has been publicly available since 2012, and it is updated every 12 months. Based on the transparent, robust, and mandatory ACPS clinical audit and our quality improvement program, we can state that podiatric surgery is safe, effective, and cost-efficient. For these reasons, it is spurious for any surgical professional to allege that podiatric surgery presents an unreasonable risk to the public at any level. Indeed, the main concern raised by our patients is the unfair way the private health insurance industry treats podiatric surgery. Legislative reforms over 15 years ago, which aimed to ensure podiatric surgical episodes of care would be treated by the private health insurance industry as though the procedure is performed by a medical practitioner, have in fact failed. The intent of these long ago passed reforms have not been realised due to ongoing barriers in regulation and funding through the Medical Benefits Schedule, or MBS, a Commonwealth government issue which must be addressed. The funding inequality of podiatric surgery means thousands of families per year are unfairly compromised despite having private health insurance, a situation which can be addressed only by the Commonwealth. For this reason, I'm calling on the government to stop this discrimination by taking positive steps in health funding reform. Please extend Medicare to include the services of podiatric surgeons now. The ACPS has for over 2 decades been working to ensure that people can access podiatric surgery to resolve their feet and ankle conditions. More recently, the college has been working with the Commonwealth Government to have our surgery and associated services, including anaesthetics and pathology, listed on the MBS. This process is unlikely to proceed, however, without positive support from government. If approved, this will significantly reduce out-of-pocket expenses faced by people accessing podiatric surgery and improve health outcomes across the community, particularly for those people whose circumstances do not allow them to spend the necessary funds. Podiatric services are already in limited manner supported by Commonwealth funding, specifically for chronic conditions and complications from diseases such as diabetes. Podiatric surgeons are the only registered specialist surgeons with accredited training who are excluded from accessing the MBS for procedures which they already safely and effectively conduct in the private setting. By expanding access to podiatric surgery, we can improve patient outcomes by reducing wait times and providing specialist care for foot and ankle conditions. An increase in the delivery of foot and ankle surgery will mean improvement in quality of life for thousands more Australians. By addressing more cases of foot and ankle conditions, productivity of these patients will also improve. MBS funding of podiatric surgery will have a positive impact on the healthcare system by reducing costs associated with ongoing management of chronic conditions and improve overall efficiency. In addition, foot, ankle and leg problems are frequently managed by GPs, and the costs associated with their management represents a substantial economic impact, $256 million per year in Australian primary care. The need for our non-surgical and surgical services cannot be underestimated. ACPS members provide 25% of their services to patients in regional and remote locations, including pro bono services for First Nations peoples. It is well recognised that First Nations peoples are more at risk from diabetes, heart conditions and obesity than non-First Nations peoples. Our aspiration is to be in a position to help address the mobility and health costs these conditions result in. With appropriate funding, we can develop the necessary relationships to enable expansion of the limited services we currently provide. Furthermore, many regional and remote Australians live in areas away from easy access to medical care and have lower incomes. This means they are less able to pay for private health insurance or the out-of-pocket costs for pediatric surgery. This also means the need for these services is clear. The ACPS can significantly increase services to those Australians living in remote areas. We can work in integrated, multidisciplinary teams of healthcare professionals and community members to advance positive health outcomes where they are needed most. In summary, podiatric surgery is a registered specialty of podiatry. We have been providing safe, effective and cost-efficient foot and ankle surgery to the Australian public for more than 45 years. Thousands of Australians can be helped to live more active and productive lives if podiatric surgery, like all other registered medical and dental specialties, was funded under Medicare. Such a reform will address a long overdue healthcare anomaly and bring Australia in line with countries like the UK and the USA. The Australian public deserve the right to choose which registered provider they want to provide foot and ankle surgery. Funding podiatric surgery on Medicare will allow patients to make this decision based on their belief as to who that provider should be.